Welcome to this fourth segment and concluding part of our series on rheumatoid arthritis. Here we take a closer look at the practical experiences and benefits of clinically supervised lifestyle correction. Now, regarding clinically supervised lifestyle correction for rheumatoid arthritis, what we are trying to explore is how these interventions, that is like this clinically supervised lifestyle correction interventions, have helped different patients who have faced different forms of rheumatoid arthritic challenges in their lives, and also the challenges faced by the healthcare provider to provide clinically supported lifestyle correction to rheumatoid patients. To start with, our first question to Dr. Jolie Thomson is, what are the benefits of lifestyle modification for patients with rheumatoid arthritis?
See, I am talking from my experience actually. I have seen the patient who are coming, rheumatoid arthritis patient who are coming to me, is already on treatment from the rheumatologist. And in India, in our part of the country, they must have tried all other possibilities like Ayurveda, homeopathy, and this naturopathy, and so many different type of medical approaches are here. And they might have tried almost everything by the time they are coming. And usually, because of no relief, they may many of them will be finally depending on the rheumatologist sort of rheumatology medications like DMA, ADIS. And maybe I've seen many patients who may be on more than 3-4 medications. Like the common prescriptions, what I see is HCQ, and some NSAID medications will be there, and the steroids like prednisolone will be there, or methylprednisolone will be there, and then this of that is mecafenate and sulfasalazine, and other commonly seen prescription is tofacitinib, and also the injections. There are so many are taking because they're not getting relief. Then they are going for further and higher and more costlier medications. And in many, they may not be able to do the. They may not be. Many of them have already stopped working and not able to go for work, and it will be. And when you say that even the ladies, actually this rheumatoid arthritis is more common in around twice, at least almost 30% more in ladies actually. And they may be actually suffering so many ways because they have to do all the household activities, and it will be even one lady, I think that she is able to get up from the bed only if the husband help is there. And many of them will be with already having taken medication for the diabetes, hypertension, and even the heart disease, this blood thinners and all. Because of the medication itself, they will be very uncomfortable, because if you are taking aspirin and all, that acidity problem will be coming, and diabetic medicine, so they will be in a mess actually. The patient will be suffering too much actually because of the medicine, and many of them. But there are few patients, there are some patients, they will be managing with reasonably comfortable with the medication, and managing with the medication reasonably okay, that is one group, and not able to manage with so many medicines also, even with so many medicines is another group. In my experience, actually, what we have a very clear pattern of monitoring and studying the patient itself, and we do a detailed analysis of the patient, and find out which food is actually their body system is reacting to which all food. It's all possible nowadays with advanced testing methods are there, whether your common staple food is making a reaction in your body. We can understand in some extent, and also which all systems is affected. In many patients, it is not only the joints, the other systems, even though if the diabetes and hypertension is there, whether their kidney is affected, whether liver is affected, whether there is fatty liver is there, or the cirrhosis is coming up. And all these things are assessed. And then what we are trying to do is with the special lifestyle modulation, and most of the patients are able to come out of not only from the rheumatoid arthritis medicines, all this diabetes, hypertension, all this medication within a month or two. Actually, that is my experience actually.
Actually, when you talk about patients of rheumatoid arthritis, I heard you say that when the patient, sometimes a patient who cannot even sign on a slip of paper, once they are able to sign on the slip of paper, immediately they feel relieved and totally contented, and then they feel that is the end of it. They don't need any further treatment because they are happy with that. Uh, what is it that makes some patients, when they get some relief, then they feel that everything is fine and they need not uh, think too much about the rheumatoid arthritis. At the same time, we know very well that these patients are not able to do all their daily activities correctly.
That is two types of patients in a way for the rheumatoid arthritis. One is suffering for a long time. And those patients were suffering for a long time. They have tried all the medications, they have tried with all the GMRDs and all the modern medicine, and they are still suffering, or they want to get out of the medicine. They are not much of the suffering, they are not worried, but they are worried about the medicine. Or they have already gone through changing so many medicines because of the side effects, like vision problem is there, which is HCQ, so they have stopped that. Or MMF they have taken, but already that lung fibrosis or some complications has set in. So they want to come out of the medication. So another patient is recently diagnosed. They have started with the episode of rheumatoid arthritis, and they have come to understand that this sort of treatment. They have already started with the other treatment, but it is not that much effective, and so they want to come avoid medicines also. So if the long-term sufferer patient, usually they understand more and they will stick to the medication. But it is recent onset patients, they are not aware of the medication side effect and all. So they get the sudden relief, they'll be usually. I really remember one patient who was first when they are coming, they were not able to sign the consent actually. The patient has to, when you're joining the clinically supported lifestyle correction also, they had to sign this thing. So they had to put the thumb impression actually. But the eighth day itself, she's able to sign the paper. And we get this. They had to write what is their improvements also in their own. Initially, she was not able to write anything. Only the guardian, the helper was doing. But in the eighth day itself, that change will be there. But that one of the patient actually, I remember that she actually on the 30th day she said that now I am okay, now I will be managing. But I don't think she will be able to. She is symptom free, but it will not be that easy. That patient actually by the 30th day she is totally come out of this. She is able to do all her house activities and do the regular work and writing and everything. But I don't know actually. So that sort of patients who will be sticking to treatment and are not. Sometimes they may be able to manage after 30 days, but preferably we monitor the patients up to 6 months. Actually, for the first 3 months, the strict monitoring will be there. After that, we will be reducing the monitoring and also the support also will be reducing and making the patient independently manage. But finally, also they should through during these days of follow up. That is 180 days. Actually, we are giving follow up. And during those days, we will be monitoring. The patient is no need for getting admitted or anything. They can go on with their routine activities and be monitoring by the in between time before in between that this monthly before checkup. In between, we'll be following it telemedicine, and the patient is directed to find out which all things is actually is triggering her problems actually. So the rheumatoid arthritis can be triggered if they take a food which is not suitable for her, or if they take a color and preservatives or something like that. This food with food additives, and also the cosmetic. Even after a hair treatment like a hair dye or hair treatment, the patient can get a relapse actually. So, but if they are on other things, we can immediately diagnose, and 1 or 2 days emergency special immunosuppressant medication also we give. If the patient is getting away from the healthy lifestyle, like using these things, then there is a chance, but they can revive, or they can manage. They're making them understand that how to manage that also, because lifestyle, and you may not be able to do a normal lifestyle, everything in the perfect order for a long run. So you may change it. There will be circumstances you may not be able to do everything in the correct way. But if the body, by the 180 days, the body will be almost settled. So then, if some changes or body can accept, and by the time they will be learning what is good and what is bad for their body, and then they will be able to manage. That is a common way. But some patients, if they think that they can manage by themselves after 30 days, that is up to them. So what is because the time period also we are giving is, the symptomatic relief will be very fast, but if the body changes, actually it is almost 90 days it takes for around, with the 90 days, if everything is correct, almost 90% of the cell in your body will be corrected and repair. It's a new cells with the correct nutrition, correct uh, exercise. The almost the 90% of your body cells will be replaced by 90 days. Then the maintenance, only the next is 10%. So that you can, it will be easy for the management. And actually, with the modern knowledge about our bodies, the body is every minute, every second, it is changing. So it takes almost 7 years for the complete cell replacement, and even some of the cells in the brain and all, the brain cells, neurons, we cannot, it will be not be multiplied or replaced. But the renovation, that the cell organelles, the cell is not a single entity. So the cell, there are so many organelles, small parts will be there. So that will be that it can be repaired. So if you, with the 7 years, you can even repair your body. And if during the 7 years, if you're going correct nutrition and correct exercise, you'll be you can become a more healthier person. But it all, the stepwise it is going. So that also the patient should understand. So it is your, if when you with the clinically supported lifestyle correction, the time period after that, it is your responsibility to look after your lifestyle, and then only you can maintain that health.
See, when we are talking about treatment for, say, rheumatoid arthritis, when the patient sees it normally, what they see is they go to a treatment center or a medical center and get the medication or a surgical procedure or something that they expect the medical center to do to them. So what is it that they have to do is basically go to the right medical center, and then they have to receive what is given from them. Now, in clinically supported lifestyle correction, actually they have to come to the center that provides this support. Then they have to be also involved from that period onwards for their lifetime to make corrections, to understand, and then follow accordingly, so that their health improves. But at the same time, for the other aspect of treatment, this support facility and all, that is support ecosystem of the patient, is not that important, because they have to go there. Either they put themselves up for a procedure, or they take some medicines. They have to just follow the medicines at the right time and then report back at the clinic. So what are the challenges that a patient will face when they opt for clinically supported lifestyle correction, as far as rheumatoid arthritis patients are concerned?
See, in the, as you said, it in the modern medical facility, that or any other facility, they'll be giving or doing some procedure on you, and or giving medication, and your duty is only to take that. So in the rheumatoid arthritis patient, you'll be given steroids, you'll be painkillers, and just take it, and your part is over by eating that. But in this clinically supported lifestyle correction, you are the caretaker of your own health. It's the healthcare provider. The responsibility is to make you understand what is the peculiarity of your body, why you are got this disease. Find out and tell you the options, tell you the corrective side of it. It's basically a training course. You are learning your primary education itself 12 years taking, 12 plus 2, kindergarten, 14 years you are taking actually. But even in that, actually, the healthcare, it's a really a minor thing in that. Actually, health is everything for human. We all know that health is wealth and everything we are telling. But even in the education system, you're not giving much importance for the health. Even the children are so obese now. That is, obesity is the most important problem we are facing in the coming world. It is facing lack of exercise, obesity. That is the problem actually. And children are becoming sick, and the young is becoming sick and getting very young age cancer, heart attack, or arthritis, and everything. Even the children of 8 and 9 years is getting rheumatoid arthritis, and it is called. Another name actually, juvenile rheumatoid arthritis actually. So this is also the same actually, because of this so much of pollution and so much of toxins entering in the body and the lack of nutrition. Here also we are thinking that the food is plenty and the rich is, especially in Kerala and all, there is no much poverty, is not much is there, that food is so plenty. Even I'm not talking about the all over India, but in the Kerala, but I am practicing. So the nutritional deficiency is so common. And so if you are looking into the nutritional aspect of the patient, so many will be having so many vitamins, so many minerals, everything will be in. But there will be, most of them will be, obesity is a major problem also. That means excess food is there, but it's only carbohydrate, and the junk food is the calorie. You're not doing any work, but you're eating so much of food that fat and this calorie oriented food like nuts or fries and carbohydrates you're eating. So we had to in this for the clinically supported lifestyle correction, we are teaching you how to go ahead with the health and showing you how the improvements are coming up also. So in the initial stage, every week itself we are checking also, and if we are directing also in the correct way, what is the changes. You should also understand that what is the change. You are taking some effort to correct your do exercise and correct your lifestyle. So you should also see the one is this most important is the symptomatic relief. You should get the symptomatic relief, and also you should get the correction in the blood parameters also. That also we are checking. And then the patient also should have a basic understanding about how to. And if the patient is already diabetes, hypertension, dementia already sits in, then definitely family members should be there to guide them. And also if the minor is a juvenile rheumatoid arthritis, the parents should also be taken active involvement. Even for the minor patients only, the patient also has to, one of the parent also has to join for the program itself. Otherwise it will not be able to teach the child how to do it, because the parent has to learn it, and some parallel parent also has to learn it and do it. That is the challenge actually. Many of the, especially in the juvenile arthritis patient and all, the patient the parents will not be willing for their lifestyle correction. So if the parent is not willing for the lifestyle correction, the child cannot be treated actually. It is not possible for the child to get in the track, because the family is doing a unhealthy lifestyle, and the child alone has to, the sick child only has to correct. Or even the family members. I remember one of the patient who's only 11 or 12 years, and she's having rheumatoid arthritis, and given methotrexate and all for the young child. So methotrexate and all is a immunosuppressant, and it is actually bone marrow depression and so many complications it can come. But the parent is actually diabetic and obese, and that parent is not willing for joining the program with the child. So in that case, there's no meaning in treating such patients, because they will not get the benefit. So it will not be possible. So that also we should understand that it is not only the rheumatoid arthritis, any autoimmune disease, and it is applicable actually not only for any diabetes, hypertension, any disease. This clinically supported lifestyle correction is applicable for any disease, especially which is all lifestyle related, because every disease has a lifestyle component. That food and exercise is important for every disease, for the recovery from any condition. So the patient should understand that, and if the patient is sick, too sick, and if they have a joint problem, they need if there is any support is needed, the family members also involvement is also very important.
With this, we come to the conclusion of this 4-part series on rheumatoid arthritis. Thank you for joining us in this journey of rheumatoid arthritis. We hope this series provides you valuable insights and help you understand and better manage rheumatoid arthritis, whether you're suffering from it yourself or whether someone else who is in your care is suffering from it. We are sure that understanding rheumatoid arthritis is the first step to getting better results in your treatments. Thank you.